Nearly every family needs help at home with an ill loved one. According to recent statistics, for every person in a nursing home, there are 3 more equally fragile and infirmed people living at home. Often, these patients need intensive medical and social services to handle serious chronic illness and disability, and to support the family. This means care delivered in the home by teams of doctors, nurse practitioners, physician assistants, and social workers. Called home care medicine, this approach is an effective, compassionate, and lower-cost option for the most ill people in our community.
I think that this is very important to do, to have medical care at home. It's not just that it makes you feel safe with your doctor, it also makes you feel at ease and know that you're going to get a great care and that they are knowing who you are.
There is so much possible with home care medicine today. When home care medicine really started in the United States, it was really focused on home-based primary care. But today, we can do things like hospital at home, urgent home visits, community paramedicine, palliative care at home. There is a wide range of all this medical care that can be provided at home today. What I think is really important to know that home care medicine is not just doctors and nurse practitioners. It is an interdisciplinary team in any one of these types of home care medicine. So usually that involves doctors, nurse practitioners, social workers, but there could be another range of disciplines involved. So there could be dietitians, therapists, dentists, a lot of different people might all be part of that team. They, first of all, are often patients and families who have been having a real difficulty obtaining care. They may have transportation issues, they have mobility issues, and they can't get routine care and end up using the emergency room and get hospitalized. So therefore, by us bringing the care to them, able to prevent illnesses from exacerbations, all sorts of things, by actually going and being in their home in advance of those illnesses, we're able to keep them and make kind of decisions about what they would like for their care in the home.
The type of patients we see are patients with chronic conditions, stroke, dementia, heart disease, lung disease. Usually these are your frail elders. We also see young adults and children with disabilities. Some practices also see patients with mental illnesses. The goal of home care medicine is to keep patients at home. In our practice, we actually state in our first visit to our patients, our goal is to keep them out of the hospital and in the home, and so we make more frequent visits than a traditional practice so that we can catch any early signs of illness and defer that. I think home care medicine brings great peace of mind to our patients, knowing they're allowed to stay at home through the end of their life.
I think what's so great about home care medicine is there's so many patients in our country who are suffering from complex and chronic illnesses. Many times it's difficult for patients to get out of their house and go into the hospital. It allows the doctors and the nurse practitioners to come to the patients where they live and to get to see them and get to know them in their own home setting. What's great when a doctor or nurse practitioner comes to a patient's home is they get to see how they live every day. They get to see the pictures that are on the mantle, the people who are important to them, the food that's in the fridge, what they're eating. And by being able to be in that intimate setting with a patient, you really get to know them and care for them in a really unique way. The key to expanding home care medicine is making sure that there's adequate reimbursement to pay for the important services that providers deliver in the home. Today, the federal government has tried a number of different things to try to provide some of that support, but there's still a long way to go. Hopefully, over time, we'll see the government, the private sector continue to step up and support these types of services so that more and more Americans can have access to home care medicine at home.
It has helped my sister very much. The doctor comes to see her. I know is coming to see her. She has all her records. She knows what's going on. Any little thing, she gets used to the same doctor. We don't have to deal with the problems in the hospital, waiting too long. When the doctor comes in, you feel much more at ease. It's so helpful. It should be done for everybody.
This is the best thing that happened to Perez family. And I give thanks to God and to everybody who's helped us.
The role of the nurse practitioner is vital in the delivery of home care medicine. Nurse practitioners have advanced training, usually a master's or a doctorate degree, focused in primary care. We do that in collaboration with their specialist, with home health care.
Having access to care services at home truly improves the medical, social, and functional well-being of people wishing to age in place, and it provides much-needed peace of mind for families. It also lowers total costs of care. Several studies and Medicare projects have shown that home care medicine improves patient experience and keeps people out of the hospital, which can lower total costs of care by 20% or more.
We represent a wide variety of professionals who provide care in the home. That includes physicians, nurse practitioners, physician assistants, and social workers as the main group, but we also include nurses and dietitians and other professionals. The future plans of the American Academy of Home Care Medicine include working on the sustainability, the payment policies related to home care medicine, and also helping advance new leaders in the field through the organization directly and also in their own practices around the country. I think this brings a lot of peace of mind to families, that they have someone to reach out to when there's an emergency. They know someone's going to give them a phone call back or come for a visit. That's the kind of care that we're providing.
We want to give a voice to those invisible patients and caregivers who strive every day to live with dignity at home and to deliver on the promise of home care medicine for all people in need. Learn more today from the American Academy of Home Care Medicine, promoting the art, science, and practice of home care medicine. For more information, visit aahcm.org.